So let's go ahead and get started talking about reducing sedentary time and ways that we can do that. My objectives for today are to discuss what is sedentary time, provide some information that we know about sedentary time, ways that we can reduce it by use of either a home-based program or the utilization of community-based exercise programs going forward. So let's define sedentary behavior, and I might use that term sedentary behavior, talking about the behavior of either sitting, reclining, or lying down posture where energy expenditure is less than 1.5 METs, and we can define what that is. The research supports that adults on average spend approximately 8 hours per day in sitting behavior or in sedentary behavior. And there might be several reasons for that we'll go through, but let's define what that 1.5 METs might be. So something like seated bathing or grooming, eating, toileting, in the area of within the home or within work, it can be sitting at a desk, completing work, doing light cooking, ironing, things that are rather leisurely, don't get the heart rate elevated too much. Other activities, board games, driving, watching TV, that's one that will come up pretty often. So we're really talking about pretty sedentary activities that don't elevate the heart rate, like presenting to a large group like this. Sedentarism is a global issue that can affect all of us in many age groups and appears to be increasing, and there might be several reasons for that. One of them being the pandemic that obviously brought us all within the home environment for much longer than we typically would be, the advancement of technology, which has increased our screen time, and then on top of that, social and motivational factors in that now we have the ability to meet with each other, be together, accomplish things, be productive virtually. And so in that, we may not have the need to venture out, travel places, meet up with family and friends. So for these several reasons, sedentary behavior has increased likely over the last several years. So just to again define that sedentary behavior can be desk work, it can be screen time. One of the things that I think our culture is seeing now is this cultural phenomenon of binge watching something. We have the ability to watch something on end over and over again without any commercial breaks. I think that's one reason why we may be sitting for much longer than we used to, but also things like long drives or commuting, that can also be considered sedentary behavior. And for people that are traveling far for work, this can be something that can affect them for several hours on top of, let's say, a desk job. So just to highlight again that something that has changed in our culture is many of us might use television watching as a sort of nighttime routine or early morning routine. And often that is sedentary, but it always had commercial breaks. And that was an excuse. I can get up, I can go to the bathroom, I can throw in laundry, I can accomplish things. And it was really within a 30-minute period, at least a couple of times that we were doing some kind of moving around or have an excuse to get up. And now this culture that we can repeat episode after episode or movie after movie and not really have that built-in time, I think is one thing that maybe contributes to more prolonged sedentary time. We know that sedentary behavior has strong association with increased heart disease, a higher fasting glucose, increased type 2 diabetes and weight gain, as well as all-cause mortality. And that there's moderate association between things like back, neck, and shoulder pain, weakness of certain muscles like our core muscles and our glute muscles, joint stiffness, some mood disturbance, fatigue. And fatigue will come up because we know that that's something that can occur during and after cancer treatments. Reduced blood circulation, and that can lead to increased blood clots. And these can be things that can affect us both, let's say, during cancer treatments, if that's where we are now, but then also even afterward as well. As I mentioned, right now, current information is most adults spend approximately 8 hours of sedentary time. And when they look at that link to mortality, it does seem to increase with the additional hours after that. And what they find is that there's a significant jump when we go to the, let's say, from 5 to 7 hours to something like 6 to 8 hours. Let's look at the effect that it can have on other areas of our lifestyle. So in looking at cognition, it's very interesting to see that there's a difference between what can happen in what they call passive sedentary time, which might be things like watching TV, or active sedentary time, which might be things like playing games, doing work, doing something that's more stimulating. And so I think the research in the now and also going forward will kind of show us a little bit more detail of how sedentary time does affect cognition. I did find something rather interesting, not my area of expertise, but in looking at journal articles showing what kind of activity happens in the brain, what kind of cognitive functioning is happening when we are doing something like watching TV. And just to show you, these red boxes are showing what they're calling a negative relationship versus when we are doing something where we are playing games or using a computer or driving or reading. It does appear that there's a little bit more positive relationship when we are doing something in the sedentary position. So I thought it was interesting and wanted to sort of pass along here as a way to differentiate something like television watching versus others. How can sedentary behavior affect our mood? It does affect our cardiovascular health. It can affect our posture, and by doing so, it can affect our sleep quality. These are things that may affect mood. And so reducing social engagement, social activity, but then also not feeling motivated to return to those things can be something that affects us in both the short term as well as the long term. When looking at different factors, like reducing sedentary behavior in combination with increasing physical activity, but also increasing sleep duration, that's where they find the best outcome as far as overall wellness. And this in particular was looking at adolescents, but I believe can also be used in looking at older adults, the fact that sleep is so important for our general recovery, and that when we are more active during the day, we tend to have better sleep quality at night. As a pelvic health therapist, I also want to mention that reducing sedentary behavior also has a positive effect on our digestive system and our ability to empty bladder and bowels, and that sedentary behavior can sometimes slow down or impede the process that naturally occurs in order for us to use the restroom. So from the pelvic health standpoint, also important for us to get good physical activity. Okay, specifically when we're talking about sedentary behavior and cancer, there are some interesting resources that have been published in order to help guide us in what should physical activity look like, and what are the ways that sedentary behavior can affect us during cancer treatments and then also afterward. And so what I'd like to highlight is that during the cancer journey, either after diagnosis or during treatment, sometimes we can see an increase in sedentary behavior, and that might be for several reasons, right? We're undergoing treatments that can increase fatigue. There has been surgical intervention that requires that we are less active actually during that period of time. Maybe there's not a lot of guidance after, and that's where rehabilitation comes in. But we can see that there is generally an increase in sedentary behavior, and that can increase not only in the immediate time, but even in the periods afterward. What we see the highest sedentary behavior in is when there's a combination of all treatments. So there is surgery, there is chemotherapy, and there is radiation therapy. And I also want to highlight that fatigue being one of the main reasons, again, that someone might experience. Now I'm sitting more, I'm resting more. I just had several different appointments in one day. Now I feel tired and I feel the need to rest. These are understandable. And when continued for weeks and months and years, we can see that it also may make us feel more tired actually when we go to do things. Also, just want to pause here and acknowledge the photo that I'm sharing, which is basically a lower body what we would call like a respirator or like a bicycle. Think it's interesting that these people are sitting on a bench and they're using a respirator. I think it's lovely, and they seem very happy about it. Okay, we know that with treatments for cancer that it can really involve many different side effects, again, both immediately and afterward. And you probably do not need me to kind of review that these are all the many ways that treatments can affect us. But what I would like to highlight is that we know that there are benefits to doing exercise during cancer and pretty high level recommendations for exercise to be used to improve things like the experience of fatigue, aerobic fitness, muscular strength, anxiety, body image, self-esteem, cognitive health, psychosocial distress, and overall quality of life. And so it's for that reason that we often have these discussions of how can we maintain some kind of physical activity? What are the resources? What are the ways that I can incorporate this into my life, even if it's very small, even if I am not doing any activity right now, or I haven't for a very long time? What are the ways we can begin to talk about moving more and not be afraid of moving more? Very often, there's concern about putting too much pressure, doing too much activity, getting heart rate elevated. Those are understandable concerns. But what we have found is that if people do not do anything, that unfortunately sometimes things like fatigue and weakness occur and reduced endurance occur because we have not exercised over time. So what can we do about it? What are some of the recommendations for reducing sedentary behavior? And that's what I would like to discuss with you. And hopefully we can all maybe share a little bit of how we are helping to reduce our own sedentary behavior. What it really comes down to is what are the total sitting hours that we have during the day that are considered unbroken? The length of those periods of time that are uninterrupted. For example, I work for 8 hours per day and I don't have the ability to get up, or I'm commuting for 3 hours per day and I don't really have an ability to get up during that time. And the other component here is post-meal sitting, which was very interesting in learning about. So these are the main things that we want to look at is how much time are we sitting during the day and for how long of a period of time, right? So we know with things like a snowstorm from a couple of weeks ago, we were basically inside for several hours. And hopefully during that time, we got to relax, we got to enjoy a little bit of downtime, but also how long were we sitting during that period of time? The World Health Organization does make recommendations for reducing sedentary behavior and increasing physical activity. And what that looks like is really some is better than none, even if it's very, very little. That we are working a little bit each day, but it can be as minimal as 2 to 3 days per week that we are doing some kind of activity. That the activity is a combination of aerobic exercise and strength training, and that the intensity can start low, but ultimate goal might be to move to something a little bit more moderate or vigorous. Ultimately, we want to limit the amount of time that we are spending sedentary. So if we are doing an activity, if we are involved in work, if we are in a hobby of reading, or we'll go through some other things, but ways that we can reduce those blocks of time that are maybe hours and hours on end. We can really bring it down to very small bite-sized bouts of exercise. So we might see this term bouts of exercise. 2 to 5 minutes of light walking is what is suggested about every hour. Walking for 10 to 15 minutes after meals might help to bring down what they call this postprandial glucose. So walking for a period of time after a meal, even if it's a short walk, is better than, let's say, waiting until the end of the evening and doing a very long walk. I want to highlight that in addition to TV watching, other behaviors that we might engage in for hobbies might be sedentary. So things like reading. I enjoy reading. I like to do a lot of researching about different topics, about different hobbies that I'm involved in. Most of the time, these things are done in a sedentary position. Things like sewing or knitting, right? Those are also crafts or different kinds of crafts like coloring, knitting, sewing that can also require us to be seated for a long period of time. Are there ways that we can maybe stand up during those activities? Can we break it up? Some ideas might include changing position, like getting up and marching in place. The use of a walking pad, that might be something we hear about now more than we have in the past. It's basically a treadmill that allows us to continue to do what we're doing, but we are walking now instead of being sedentary. Other ideas to connect activity with something that you do on a regular basis. So if we brush our teeth once or twice a day, that we are doing a marching in place during that 1 to 2 minute period that we're brushing our teeth. If we're going from a seated position to a standing position, that maybe we're doing a couple of squats or what we call a sit to stand exercise during that period of time. You know, for us in the New York area, we use mass transit. So things like getting off of the train to stop early, so that we can walk a little bit more before we get to the destination that we have to get to. Things within the home. So we can be active in cleaning the home, in reorganizing, in redecorating. All of this actually is physical activity. And so if you're watching something, if you're into a movie or a series, but you're able to take breaks, do a little bit of something during that period of time, remember the bout of exercise really can be as little as 2 minutes that you are doing something every hour or so. To have motivating factors like finding something new or some place new that you would like to go, that can help drive some motivation to be more active. I know I have treatment for these next 2 days, but on the third day, I'm going to go to this place I've been wanting to go to. Having some kind of goal might bring us to the point that I'm actually motivated to do that because it's something new. I'm doing this with a friend or family member, and it might keep us accountable for that particular activity. Something I'll talk about also is when we look at the reasons that people are reluctant to move or to do exercise, one of them might be they don't know where to start or they're concerned about injury. And that is where we see that at least the initial use of someone like a physical therapist like myself or a coach to help you with an exercise plan can help you into that entry point. And so that's what we are here to do. Some other ideas that I've come across over time, not original ideas, but things that came up are things like when you're sitting down that you're using a smaller water cup. So instead of these large cups or thermoses that you see that can hold like 60 ounces, which is a good amount of fluid, but if I use something smaller, then I have to get up more frequently in order to refill it. And so that in itself can be an excuse for me to move where maybe I did not in previous days. To have some kind of alert on our phone, on our watch, that gives us a little cue every hour or so that we should be getting up. And I also outlined here Siri just because you can say, hey Siri, set an alarm for me to get up every hour as a way to gently remind us that it's time for us to move around. For those that watch sports, I just like to highlight that, you know, sports have this sort of built-in period of time where there's a break, we're able to get up, we can move around, we can be active if we hadn't been active, let's say earlier in that day. And I would just like to personally say that if you do choose to watch any particular sporting event, I hope that you watch hockey. And when you do so, I hope that you watch the best team that we have here in New York, and that is New York Islanders. And if you do so, you'll be supported by the highest evidence that right now they are superior team in New York, full sweep, all 4 games this season. Okay, other ideas. Things like when we are trying to catch up with family, friends, communicate with others, that actually we call each other now. I know we've gotten into the culture of texting people often. Usually when we're texting, we're probably sedentary. So if we can do things like make a phone call, that allows us to then maybe walk during that phone call. I'm walking around the house. I'm walking around the neighborhood. I can be more active, especially if I'm using a headset. I don't have to be tied to the phone. I can do a little bit more. It frees us up. We're more likely to be active if we're having some kind of conversation during that time. We can also use a walking format for things like meeting with people, seeing friends. Maybe I don't want to go to a restaurant to see someone, but maybe we have this meetup where we just take a walk together, especially as the weather gets nicer. So we're going to together think about making a movement where we call people more often than we text them so that we can be more active. Again, walking, easiest, simplest thing for us to do. We don't need any equipment for it. In general, the weather is pretty good, although I know we're kind of dealing with some cold weather now. But a couple of minutes every 30 minutes to 60 minutes or so. So thinking about maybe after meals, I take a walk around the block, or after a sitting meeting, I get up and walk around a little bit so that I get some increased blood flow, so that my body wakes up a little bit after sitting for a long period of time. As we work towards being more active, doing these bouts of exercise that can be as little as a couple of minutes, but working up ultimately to what would be what we consider exercise guidelines for activity. And the American College of Sports Medicine recommends that we exercise in both aerobic exercise, which would be likely a continuous exercise, 20 to 30 minutes, all or most days of the week. So if we're starting at like a 5-minute bout of exercise, that's good for us to do. It's beneficial. It's recommended. And then as we feel more comfortable, increasing that bout of exercise to something closer to 9 minutes, 10 minutes, and then being able to accumulate 20 minutes or even 30 minutes, and it can be at a time. The frequency is recommended as being 2 or 3 days per week, but it can start at just once a week. Just once a week is a good place to begin so that we can get familiar with movements, so that we can get comfortable, and then we can increase in the frequency. The intensity can start light, but ultimately the recommendation is what we call this moderate to vigorous intensity. And how do we define that? Most often it is used as a perceived exertion, and we'll talk about what that might look like. So this activity feels like I'm basically sitting on the couch, or this activity feels like I'm really working very, very hard. I would have difficulty sustaining a conversation while I'm doing this activity. We also can use heart rate variables as a way to help us identify intensity of exercise. On top of that, exercise recommendations are to engage in resistance exercise a couple of days a week, and that is to improve muscular strength. How is it that exercise can help us? Well, when we really look at the physiology of muscle, it acts as part of the endocrine system in helping to release anti-inflammatory myokines that can inhibit tumor growth and support immune surveillance. So that's why we promote both aerobic and resistive exercise, both during cancer treatments, but also even afterwards. If you're not currently exercising, there are many ways to begin an exercise program, even if it is at home, even if it is a few minutes per day. So it might look something like a small warm up where we are just getting the heart rate elevated slightly, marching in place, arm circles, squatting or a sit to stand. Then we might go into the routine, which is where we are doing maybe a set of 5 or a set of 10 repetitions, doing wall push-ups, and I have pictures of what some of these things might look like, doing some heel raises, and doing a little bit of a circuit where I'm kind of toggling through each of those activities, even if it's for a short period of time, and then moving on to the next. So exercises that we don't need any equipment for, things like a wall push-up, keeping our body nice and straight, lowering down towards the wall, pushing through the wall like you're trying to knock it over, performing a sit to stand. If you're able to do this without the use of your hands, doing it without your hands, that way your legs and your core are doing all of the work for you. Calf raises, you can use upper or arm support if you need to by using a chair, by using the wall. Marching in place, I mentioned that earlier as being maybe part of your brushing your teeth each morning and each evening. Arm circles that you can do in order to keep circulation in the upper body, keep flexibility of the upper body. We can alternate between all of these exercises Also want to mention that even in a seated position, there are many exercises that can be done. So seated row, pulling lat pulls, leg or ball squeezes that we see there, some scapular or shoulder blade strengthening. These can also be done in a seated position, and we really don't need a lot of room or space for them. Resistive bands, free weights, any of these things can be used for a resistive exercise. Here we go. So the use of free weights, the use of your own body weight, and the use of resistance bands. These are small resistance bands. They can kind of fit anywhere. I often recommend the use of resistance bands if you're traveling, you don't really have a lot of time to do any exercise, or you're not sure the equipment of where you're going. Resistance bands are easy to pack, easy to move around. Let's talk about this barriers to entry, because this does come up as far as people being reluctant to start an exercise program, and how us as healthcare professionals are really meant to help bridge this. Being more active has been shown to be better than being less active. So we do want to encourage, even if it's small levels of physical activity, that we do so. And when we look at what are some of the injuries that are reported when people actually do consistent home exercise program, what they find is that they're mostly minor adverse incidents. So things like muscle pain or soreness. In some circumstances, if someone is undergoing different kinds of treatment, they have reported some other immunologic things like that needed to be treated, but they are able to consult with their medical team in order to provide guidance on those things. And again, this is really where working with the healthcare professional can be that person to help with providing feedback or referring if that needs to be done. I wanted to show you the scale that we use for exertion. We use this, what we call Borg scale, showing us on a scale from 6, which would be none or very, very light intensity, down to something like a maximal exertion. And exercise prescription ultimately is working towards getting someone into this middle range, somewhere in the 12, 13 range, where it might be somewhat hard. And what we would call moderate, almost even into the vigorous category. This would be an ultimate goal. It would not necessarily be somewhere someone needed to start from. I want to highlight that now we have so many apps that are available for people to be guided through exercise. So this particular app, I just wanted to highlight, shows a large variety of movements that it coaches you through. I'm showing you the instructions here. It basically is giving you a certain number of movements. You're to do each of these movements, a certain number of repetitions, and it brings you through the circuit. Something like this, where you don't have to think about what it is that you should be doing, but rather it kind of guides you through. And by the way, these movements do not have to be done perfectly, even if they are a very small attempt, even if they are what we would call partial movement or partial range. It's still better than not trying at all. So these are meant to be available to us. They're in the palm of our hand. We can easily refer to them. They likely give us alerts in order to participate in them. So if you are someone who likes to use technology, these apps are available to you 7 days a week, 24/7. Other things that can help people to stay on track or to maintain levels of activity would be, in the app, we also have things that track our number of steps, things that track our heart rate, things that can help to keep us more active, and also even set a goal so that I can compare the amount of activity that I did this week versus the amount of activity that I did last week. And in doing so, it might actually help me to feel motivated next week in order to do a little bit more. So these tracking devices can be rather successful in keeping us more compliant. I want to share that within our NYU Langone Health and Perlmutter Cancer Center community, that there are several opportunities to be more active at any point during the journey, whether it's during cancer treatments or even afterward. As you now know, oncology rehab here at NYU, we have a large number of therapists that for quite a while now have been able to work with you in order to address some of the issues both during treatments, but also afterwards. Here's a picture of us. There we are. There we all are sitting down, just taking a small break from the day that we have. We also have some wellness programs that include Tai Chi. This has been a successful program for a while, and I know that patients really enjoy participating in the Tai Chi program. But there are also some other activity or some other programs, including strength training by Strength for Life, and also chair yoga that is offered. I believe this is in the Long Island location. So these are ways that you can engage in guided activity that you really don't have to think about too much. Someone is really guiding you and keeping you consistent and therefore answering questions that you may have. The Cancer Fit program is another opportunity for maintaining physical activity levels. It does require that you have medical clearance from your physician, and so we're able to sign you off that you're able to participate in the program. And here's a look at what the Strength for Life website offers. They have exercise classes. It looks like they have wellness retreats. They also have virtual classes. We were talking about that before. So plenty of opportunities. And one last thing I wanted to share with you, which is this Shape Up NYC. And this is basically through the New York State Department of Parks and Rec, that they offer several locations all around the city where you can participate in different exercise classes. And I believe they're all free. So to summarize, what we know is that when it comes to sedentary behavior, that some activity is better than none. So even if we are getting up for only a minute or two at a time, that it's beneficial to break up that prolonged or unbroken sitting time, that we want to aim for exercise 2 days a week or more if we're able to. But other words of advice that I found was the fix is not that we exercise harder, but just that we move more. So we can take the emphasis off of feeling that we have to meet a certain threshold of exercise, but really just that we are breaking up the activities more so during the day. And I believe this is the end of what I have to share with you. I hope that you found this helpful, and looking forward to any questions that you may have. That is a great question. That is a wonderful question. And the answer is exercise can help with reducing cancer-related fatigue. It may feel as though it might make it worse, but in fact, it has been shown that if we are able to exercise, even if it is in these small bouts of time, that it can help to reduce fatigue. Joint pain, especially in the knees. Well, I want to just speak specifically to, sometimes this comes up, joint pain or joint stiffness, especially in relation to hormone-related therapy. And I'm thinking of breast cancer in particular. And in fact, exercise has been shown to help reduce those symptoms of joint stiffness and pain as it is related to some of those hormone-related treatments. So my answer is yes, it can. Usually it means a strengthening of the muscles that are surrounding the joint, like the quadriceps muscles, the hamstring muscles that are surrounding the knee joint. But I think it would matter, I guess, a particular case by case. If you've been able to start exercise and you feel as though there are things that you don't know about movement, about form, about pain that you have, and you're looking for more guidance, that is what a therapist or an exercise specialist is there for. So if you feel like you need guidance, especially to begin with, if it's immediately after a treatment or immediately after a surgery and you're unsure of where to start, that's usually a good place to be. Is it better for what? So that would be my first question. Is it better for what? I think what we are talking about in just being more active in terms of reducing the effects of sedentary behavior, what we are learning is that if we break it up more frequently, that helps us to achieve that. And I would also just say that sometimes when we kind of push things to one end, okay, I'm going to do a workout in the evening, I'm going to do all 30 minutes, and then we get there to the evening, sometimes it doesn't happen. I might actually be more successful when I just break it up during the day and I'm able to achieve a cumulative 30 minutes if I've done 10 minutes, 10 minutes, and 10 minutes. The name of the app is called Seven. When you click on the movements, you can see the figurine is like performing the app or performing the exercise.
Right.
Just for a little bit of guidance, it's kind of showing you what it might look like. Yeah, I would say you want to maintain physical activity as much as possible. And if it feels as though there's a lot of limitations to what you are able to tolerate, because I also want to acknowledge that when we are in a lot of pain, that it's very difficult to move through a high level of pain. And so managing that in working with a physician, if that's needed, for other kinds of consulting, if that's needed, so that movement becomes more bearable, that may also need to be prioritized. So what I'm saying is if we know that a joint, let's say, has lost a cartilage and that it's creating a lot of stiffness and that movements are becoming more and more limited, it might be something that needs medical intervention, but also know that maintaining physical activity is recommended and will not harm. You know, I that's something I can't comment on, that particular style. I want to thank the person for bringing up breathing exercises because it is so important, and we do this often in physical therapy and education for performing breath work, both during treatments but also during the day, outside of therapy. I know that there are many, many different styles of breathing exercise, but just to speak to the fact that breathing has a lot of benefit for improving circulation, for improving nervous system activity. So I would encourage the use of breath work, but and that particular style I cannot really comment on.